Compassion fatigue and new physical therapists. So what is compassion fatigue? We've probably all heard of it at some point. I wasn't exactly sure what it was prior to doing this project. So every day in every setting, PTs face clinical and administrative demands. Compassion fatigue is the relationship between three things: burnout, secondary trauma, and compassion satisfaction. Burnout would be the psychological side of things, the mental exhaustion and reduced accomplishment you get while working. Secondary trauma would be the exposure to extremely or traumatic stressful events. This could be seeing patients in poor conditions, maybe they're not progressing as well as you'd like them. And then compassion satisfaction kind of ties in from both of those two. It'd be the pleasure you derive from being able to do your work well. It's important to be able to recognize the symptoms and effects of compassion fatigue. That way you can recognize them if they happen to you, and you can take action if needed. So symptoms of compassion fatigue, I'll let you read that because you can read as well as I can. But you just want to be able to keep an eye on your mental state and your happiness, be able to self-evaluate to see if you have any of these symptoms. And effects on the PT's health, I'll let you read those as well. It can have a lot of negative effects on the PT's health. We need to be able to take care of ourselves. That way we can take care of our patients. Some risk factors for compassion fatigue. It affects women more than men, people with low self-esteem, history of exposure to abuse and trauma, someone who might be a perfectionist and have high standards, as well as someone who lacks self-awareness. So this job person fit model does a great job at giving a visual representation of the things that affect our work life. It's composed of 6 domains: workload, autonomy, perceived efficiency, perceived rewards, workplace community, and workplace ethics. If some of these domains start to outweigh others and there's an imbalance, your risk for compassion fatigue will increase. A good way to increase your chances of having a balanced job person fit model is to interview properly and ask the right questions. That way there are no surprises when you start working there. So here are some tips and questions to ask when doing an interview. Productivity standards. Ask about how many PTs they have, working on personal time, and what the turnover rate is for the position that you're applying for. Ask them what administrative and interprofessional expectations they'll have of you. That way they don't surprise you with a bunch of jobs that you didn't know you were going to have to do. Pay is something that a lot of people are kind of scared to ask about, but you can and should ask about it. Loan forgiveness is very important, especially when you pay a lot of money to go to school. Always ask if it's available because they may not always be upfront with it. And if you're interested in having a mentor, ask about possible mentorship opportunities.
Find yourself fatigued or are looking to prevent it. Observe yourself for at least 3 weeks and take notes, being as specific as possible. The first step is to figure out what is causing stress and how you are reacting to it. Understanding how you respond then guides how you will treat it. For example, do you find that your heart rate spikes or that your thoughts become more negative or repetitive? To manage these would be to work on deep breathing exercises for the heart rate versus meditation techniques or journaling for the thoughts. Next, determine the root cause of why you become stressed. Normally, people assign a phase or task to this when the reality requires far deeper introspection, and it typically reveals a behavior they either encounter or exhibit. So once all of these components are identified, what can you do about it? A key to stress resilience is disrupting the thought patterns that come from negative beliefs about the world around us. These are commonly rooted in 4 general thought fallacies. The first is that our limitation of knowledge is a personal failing. The second is related to the fact that we are leaders within our field. Whether it's leading a team of physical therapists or assistants or techs, or even leading a single patient through their treatment, the result is sacrifice syndrome, where we continue to give without receiving anything for extended periods of time. Furthermore, there is inherent stress to being a leader and making decisions called power stress. The third is essentially based on the idea that we give altruistically to the point that we don't take care of ourselves. Finally, the idea that we as professionals must keep our emotions in and controlled at all times. We are human and it's completely normal to express yourself. Daily actions are areas where you can take small moments of time to buffer feelings of stress and fatigue. What's even better is that multiple studies have shown that each of these categories individually have shown mental and physical benefits towards our health. Mindfulness is being considered awake, aware, and attending to yourself or inside the self. It's been shown in multiple longitudinal studies to have years of benefit if trained or practiced, and it includes activities like journaling, meditating, and emotion mapping. Hope is articulating goals believing one can attain them, charting a course of action while experiencing a sense of well-being once you've attained it. Hope is dependent on creating clear and articulated goals and the sense of well-being that comes from actually attaining them. This means that you have to be realistic with what your goals are and just how small or manageable they can be in your daily life. This is also one of two categories where growth, in this context, actually causes increased benefits and others as well. Compassion is the combination of empathy and caring and action, so recognizing and understanding where people are coming from and then being able to accurately act or speak in their lives for good causes. This is the other category where acts of compassion also benefit others' health when expressed. Given that we are working with people all day, every day, and in close context, our field is one of the few that regularly has a significant opportunity to do good in people's lives and improve patient health. It certainly isn't a comprehensive list, but the key points I wanted to focus on are laughter and play, uplifts, and the wait until mentality. Laughter and play require understanding what it means to be present in the moment and actually taking rest from the day to day. For many professionals, a vacation means going to a work conference or assisting someone else with a project, when instead it literally means, what it should mean is to take a break and have fun doing something else. Having a regular hobby that's just for you and helps you separate from the stress of work. Uplifts is just a different word for good moments in a day, focusing on the small things in your day that make it better, instead of focusing on the minor inconveniences or hassles. This can also tie into shifting perspective. The final one is the wait until mentality that I think most, if not all of us, regularly experience or feel pressured to experience. It literally means I will do this thing I enjoy only once I have this other responsibility done. So how many times have you said, oh, I'll go to bed, I'll eat, or I'll take a break, or I'll even take that vacation once I'm done with this chapter, report, or project? Of course, there is moderation, but the unfortunate truth is that this mentality actually creates a chronic delay of gratification. It promotes burnout, impairs performance, and significantly limits the range of activities that we get to engage in. This lack of diversity and delayed gratification is an awful place to live in, so breaking this fallacy of expectations can bring significant relief and understanding to your life. There are general tests online that you can take for burnout and compassion fatigue for free that might not be the most officially validated if you can't afford a formal assessment or if your workplace won't cover it. But the primary point is that you recognize your own stressors, your own reactions, and your own well-being and health. Two of the resources provided are examples for mentorship programs, something that has been shown to significantly decrease burnout among new graduates. And the final two resources are books that I highly recommend anyone should read. They have been incredibly helpful for me and are made to help working professionals be their best and healthiest self.